Testosterone, hormone of the gods. If you inject this stuff or use it, you're going to look like Arnold Schwarzenegger, even if you're 60 years old and a little flabby, right? Probably not. Come back. We're going to talk about testosterone use in men who have age-related decrease in testosterone. How many folks is that? That's a lot of guys. Should they all be on testosterone? Probably not. Hello and welcome back. I'm Dr. Oscar Hernandez, board certified internist and practicing pediatrician. Yes, practicing pediatrician, but talking about low testosterone in men. Why? Well, because I'm an internist and I see a lot of guys with low testosterone. What is the tip-off to a man having low testosterone and following that rabbit trail to see if the man should have any testosterone replacement? Well, a common complaint that I get from guys is that the bird doesn't fly. We've got a little erectile dysfunction, and that doesn't make for a happy marriage sometimes, and sometimes you just don't feel like King Kong anymore if things don't work below the belt. So that's sometimes the thing that we use to go down the rabbit trail of some of the other symptoms of low testosterone. What could they be? Fatigue, tiredness, decreased mental alertness, getting a little flabby in the belly maybe the muscle ain't what it used to be, things aren't looking the same way as they used to, maybe you're losing a little bit of body hair, especially around the legs, and some places things are thinning out. By the way, this has nothing to do with male pattern baldness, that's a different animal. So when we see this in men, we think that they may have age-related low testosterone. How do we know if they have low testosterone? Well, we can check the blood level. By the way, it's not a very good test because it should be checked at about the same time each day if you're going to do comparison levels, because testosterone does have a diurnal change according to the time of the day. It's also not a fabulous test because sometimes you get guys who have normal testosterone, usually on the low range of normal, and they still feel these symptoms. So the testosterone level is not the end-all test to decide if I'm going to give a man a testosterone supplement. Do testosterone supplements work? Well, the labeling of all these testosterone products, according to the FDA, if you have a testosterone prescription, you look at the package insert, it says that it is only useful and recommended in males who have secondary hypogonadism. That means that they have some problem with the pituitary gland, or maybe they were born with a problem with the testicles, that they did not produce sufficient testosterone, or for some reason they have had surgery to remove the testicles or treatments that require suppression of testosterone. And these are called secondary causes. However, there is another cause of low testosterone, the most frequent one. And the most frequent one is age-related low testosterone. Remember, men start to decrease their testosterone levels at about the age of 35 years of age. And let me look for a moment here what my citation says. They lose their testosterone level. They say I have a decrease about 1.6% per year. So imagine, by the time you get to be 60 years of age or even 50 years of age, you've lost a lot of testosterone production. Now, not only do we measure the total testosterone, we measure the free testosterone. That's more important than total testosterone. Free testosterone is the testosterone that is actually available in your blood to impact the tissues, whether it's the muscle, the brain, the bone, avoid osteoporosis, and all these kinds of things in men. So it's not only that it's total testosterone. When I measure testosterone, I measure total testosterone and free testosterone. Okay, so testosterone goes down. What should we do about that? Again, the FDA says that men with age-related testosterone really are not people who should be getting testosterone supplements. However, this is a very common thing, as I've already said, and the American College of Physicians came out with its own guidelines in January of this year. Folks, we're in October, and I'm talking about something that happened in January. Why do you think that is? Because we've been overwhelmed with COVID, right? I mean, that's the excuse for everything, but really it is the excuse for why we're late on presenting this stuff to you. The American College of Physicians came out with very specific guidelines about who should get testosterone. And it has to do with the fact that when we look at a lot of studies, men who get testosterone don't get better from a lot of those symptoms that I said to begin with. The fatigue, the loss of muscle, mental acuity, they get more depressed, they don't have as much activity, they get more sluggish. Now, that doesn't happen to all guys, but it happens to a lot of guys. And the older we get, the more likely it is to happen. And of course, the issues that have to do with sexual performance. The American College of Physicians guidelines looked at studies that were between 6 and 36 months of giving guys testosterone to see what the effects would be on these men. Most of these studies that they looked at were less than 9 months duration. And it's important for me to mention that because that's part of my objection to some of these guidelines. I've been treating guys with testosterone treatments for a long time. So here's what they found. It really didn't help anything, with the exception of possibly and low quality evidence helping them when it came time to look at their sexual vitality. Whether that was a placebo effect of I'm now using testosterone cream or injection and now things are going to get better, or whether it was a real effect on these men, I don't know. I think it's a real effect on the guys. But the point is, the only recommendation that the American College of Physicians found when it looked at these guys had to do with sexual performance. And even then, their recommendations are rather flimsy. They say use testosterone or discuss testosterone use in men who have sexual dysfunction and low testosterone, and then see what they look like about 12 months later. And if they're not getting better, you can stop the treatment. It wasn't working. Time out. Here's the problem. The studies that were done and that they used for these recommendations were studies that on average were less than 6 months long. Sometimes it takes a long time for men to get benefits of testosterone use when it comes, for example, to bone health, right? It takes time to build muscle. And if you were looking at a 6-month study, you may not have had time to build muscle. And if all you were doing was using testosterone and you had no activity, you weren't doing a little weight conditioning and stuff like that, it's probably not going to show. The other problem that I have with these recommendations that came out in Annals of Internal Medicine in January of this year is that they don't recommend measuring levels. So you give a guy a shot, it's the same dose, you're not monitoring to see if the testosterone levels came up, and you see, look at him 1 year later and say, hey Harry, how do you feel? I don't feel any better. Oh, well, I guess the testosterone didn't work. Well, did we have the right dose, right? So the American College of Physicians guidelines do not talk about changing dosage based on levels. And maybe that's because of one of the things that I said at first, that levels sometimes aren't reliable. They are vary from lab to lab. They vary from time of day to time of day. But then that's when the physician's brain needs to click in, use the same lab so that there isn't lab to lab variability when they're measuring these levels, and also be checking levels at about the same day. And you got to talk to your patients and tell them about this. So if you're one of my guys and you're using testosterone, please don't come at 4 o'clock in the afternoon to measure testosterone if you had it measured at 9 a.m. the last time you came. The levels are going to be different. They're going to confuse me. I'm sure I've said this to you if you're my patient, but if not, you're seeing it on the video today, and now you know. So what do I do with men with low testosterone who have any of those symptoms that I previously mentioned? I give them testosterone, especially if the free testosterone is low. Even if it's not low, I sometimes give them a trial of testosterone to see if it will go from the low normal range to the mid-normal or high normal range. The other thing I do with these fellows before I give them any testosterone is make sure that they don't have an elevated PSA or any evidence of prostate cancer. We look very carefully also at the family history, especially if you had a brother or a father who had prostate cancer. So what we want to do is make sure that if you're going to use testosterone, we do it safely. If we see any rising of the PSA, we're probably going to stop the testosterone. Testosterone treatment does not cause prostate cancer. You heard it, you have it on video, you can play it back as many times as you want. Testosterone treatment does not cause prostate cancer. However, if you have prostate cancer, you should not be on a testosterone supplement. So that's why I check the men that I give testosterone to very carefully to make sure there's no evidence of an underlying prostate cancer. That's all we have today. We've talked a million times about estrogens in women and replacements and so on. We've talked about it on our radio program. We've talked about it on some of these videos. So let's make sure that we cover the guys too, because, guys are important. They matter too. Hey, thanks for listening. If you like the program, give us that thumbs up. subscribe. You're not going to keep getting these videos unless you subscribe. You're going to have to scrounge around and look for them. Hopefully we've given you information that you like and that you can pass on. If you're not a guy and you've been watching this video, pass it on to your husband, pass it on to a friend. We all know men, and we all want to make sure that they stay healthy. Thanks for listening. We'll see you next time.